So how electrohomeopathy works is purely based on patient condition. Different patients have different, okay, different patients have different improvement. Okay, first I will explain that normal patient. Okay, normal patient means you give the medications, he started improving. Okay, nothing happened to him. He started improving. This is a direct improvement. Okay. Next is some symptoms will seen in the patient. Okay, some symptoms will see in patient. Okay. What type of symptoms like uh, he or she have sweating, excess sweating, it may happen. He or she have loose stools. He or she have excess urination. He or she have excess urination. So some patients will seen this kind of symptom. Some are normal, some are some will get this type of symptom. Third type of patients, what I got experience that he or she may feel uncomfortable. Okay. Some patients have uh, increased symptoms like body pain. If they have no pain, if they have, will see the body pains or feverish. Okay. So this type of symptoms also can be seen in the patient. So all this because of the because the body is in this condition that it need a repair. So during the repair or healing or curing process, all these symptoms can be seen in the body. Okay, because our body is a is designed to heal properly. Okay, so everybody took their own way to take the healing process, to take the curing process. Okay. So before giving the remedy, you have to explain the patient about these conditions because initial days I am unable to explain these things to the patient. So what happened? They think that because of this remedy, I am feeling that. So because why she or he have setting because the whatever uh, body toxic material which is stored in the body is releasing with the help of sweating or with help of stools or with the help of urination. So body is for first remedy what is doing it is removing the impurities from the body, toxic material from the body. Okay. And sometimes body pain, feverish. Why this happens? Because the patients have inflammatory condition in the body. So during this process, what happened? The inflammatory condition will rise some for some time, then gradually it will decrease. So due to this process, patient will feel body pain, feverish, okay, weakness, sometimes weakness also. Okay. So be sure that you are explain everything to the patient. Okay, then he will have the picture that sometimes it will happen 90%, 80 to 90% nothing will happen. 80% this first type of thing. This is the 10 to 15% patients. This is for 10 to 5%. Okay. Most of the chronic cases, most of the chronic cases from past 4 years, 5 years, they have lumbar pain, cervical pain, knee pain, any type of pains. They will get this type of things, and subacute and initial chronic patients, like they have from past 6 months, they have rheumatoid arthritis. Mostly in rheumatoid arthritis, you can see these symptoms. Okay, yeah. Second symptoms or third symptoms. Okay, so let's continue. So this is very important thing which I missed to explain you. Today we are going to talk about an important topic, that is pulse diagnosis. Basically, the pulse diagnosis, everyone think that it is belong to Ayurveda, Unani, huh? And nowadays in acupuncture, TCM. Okay, so basically, pulse diagnosis is a way to diagnose the disease depending upon the philosophy of pathic, each pathic, different path. So pulse diagnosis is not same in all pathies. They are different. First thing. Okay. So it is purely depend upon philosophy, law, okay, and purely depend upon philosophy and law, and whatever principles are there, principles are there, principles, law, or philosophy. They believe in that path. Okay. So Ayurveda will have different principles, law, and philosophy. Unani have different things, and TCM have different things, and electro-homeopathy have their own philosophy, own principles, and own law. So depending upon the principles, depending upon the law, depending upon the philosophy, the pulse diagnosis is designed. Okay, so thus that pulse will give this, depending upon this principles, will give the diagnosis criteria to you, and you will select the remedy according to that diagnosis. So this is different from other pathies. Okay, so there is a reason pulse diagnosis is not which explained Ayurveda, Unani, and TCM. Okay, so I think you understood. Okay, this pulse diagnosis. Basically, I told you that this. Uh, so this diagnosis is developed by Dr. Sanjeev Shah. Okay, just Sanjeev Sharma. Okay. So let's discuss about this pulse diagnosis in detail. So this is the part one. In part one, part two, we will divide in part one and part two. Okay, pulse diagnosis. Because we will learn about basic things, then related things to the theory. First, second is we'll do practical demonstration also after completing of this. We have only this pulse diagnosis, and after how to take the case. Again, starting to beginning, we will make examples of one to two diseases and make the how to make the protocol. This is the one thing I how to make. So during that process, we will learn the starting to ending of the how to take case history. Okay. So in this part one, we will learn okay about pulse diagnosis. So basically, we have in Ayurveda and Homeo and TCM, we will use three fingers. Okay. But in electrohomeopathy, we will use only two fingers. This is the basic thing we have to remember. Okay. Which two fingers? Index fingers and middle finger. So which fingers we use for pulse diagnosis? We use index finger and middle finger. Okay. These are the two fingers we use. So basically, we have two temperaments. One is sanguine, one is lymphatic. So that temperament will give the hint. We added these two fingers, that two temperaments. This is the sanguine temperament and this is lymphatic temperament. Okay. So middle finger is lymphatic temperament and index finger is sanguine temperament. Okay. So this is the first thing we have to remember. So we are selecting only two fingers. Okay. One index finger and another one is middle finger. So sanguine, for sanguine temperament, we are selecting index finger. Okay. And we are selecting middle finger for lymphatic temperament. For mixed temperament, for we use, we will get, we will know in coming class. Okay. So about mixed temperament also. Okay. First understood. Okay. This thing clear till here. Okay. Next.
Yes, sir. Yes.
Next is where to keep the finger. Where to kept the finger. This is the very important thing. So basically, so we have hands, we have a number of areas where we can touch the finger and observe the pulse. Okay, let's see that first. So in the body, we can feel the pulse in different parts, different area, different region. But this pulse indicates that how your body is doing the blood circulation. Okay, so we have here carotid pulse. Okay, uh, in this neck region. Okay, so whenever a person have heart attack, whenever a person have uh, any giddiness and he fall down, so okay, you have to check the carotid pulse. Next, we have the brachial pulse. Here we have the apical pulse. Here we have the radial pulse. This one is very important. And you have femoral pulse. And we have the popliteal artery. And we have the pedal artery or posterior tibial artery. So these are the areas where you can feel the pulse. But we are only in the electrohomeopathy. We are selecting this radial pulse. So this is the thumb. This is the anterior part. This is the posterior part. This is the anterior part. So in the anterior part, this is the thumb. Where the thumb is going on, that we have a radial bone. What we have? We have radial bone. There we have radial artery, radial nerve. Okay, all those are there. Okay, so basically in the thumb region, thumb line, we have this area. This is called wrist. Okay, at the ending of the wrist, at the beginning of the hand. Okay, okay. So this there we have radial artery, radial vein, radial nerve. So next, let's locate the area near the wrist. So this is the area which you have anterior hand, wrist. You can see that these are the veins, arteries, nerves, all these are there. You can see that this is the thumb. So you will able to see this is the thumb. Okay, carpals, metacarpal bones, phalanges. Okay, this is the, so you have seen ulna. This is the radius bone. Above the radius bone, you can see this is the radial artery. This is the median nerve. Okay, so you can see this is the radial artery. Okay, so in that radial artery, you have to keep these two fingers. Another image, you can see that. Okay, like this. But okay, but you have to come this side. Like this, you have to keep. Okay, like this. But here I am to show you that. Okay, so this is the radial artery where you have to keep both fingers. So where to keep the finger? On the radial artery. Where is radial artery? It is beside the thumb. Thumb, thumb region. Okay, you have to remember that. And thumb connected with radial bone. So radial, above the radial bone, we have radial artery. So this is the location of radial artery. It's okay. So understood which fingers we have to take, two fingers. Where to keep, we understood. Now how to kept, how to keep the fingers. So basically, if this is the thumb, okay, if this is the thumb, so opposite side hand will use. So if you are checking in right hand, you have to keep two fingers. You have to keep two fingers of the opposite side hand. So you are selecting the right hand. So you have to keep left hand there. What you have to keep? You have to keep left hand here. So okay, this is my right hand. I am keeping left hand here. So which finger come first? Okay, we have to keep first finger is index. Then second is middle finger. Okay. First finger is index and second finger is middle. So which fingers we have to select? Middle and index finger. Middle for lymphatic, index finger for sanguine. Okay, first step. Second step is where to keep the fingers on radial artery. Okay, third thing is then how to keep the finger. You have to select which hand you are selecting. The opposite hand you have to keep on that radial artery. So which finger, which side? The thumb, where the thumb is there, you have to keep your first finger, that is index finger, then your middle finger. Okay, like this is my right hand. So I am keeping my left hand here. First is index finger, second is middle finger. So this is the area where you have to keep the finger, and this is the area where how to keep the finger. So both three things we learn. Next, very important that, so we selected the finger, middle as lymphatic, index as sigmoid, and we are keeping on radial artery. And the main important thing is that this is the finger. So we are dividing the finger into three regions. How many regions? One, so sorry, one, two, and three. Okay, where we have the nail, till the nail, we are dividing the finger into three regions. If there is, this is the nail. Okay, so we are dividing one, two, three. This is the one number, till here one number, till here two number, till here three number. Okay. Okay. If this is a finger in both index and this is the one number, this is the two number, this is the three number. Okay. So we are dividing the finger into three divisions. Okay. So the three divisions we are giving number one, number two, and number three. So where the near the thumb we are giving one number, near the thumb we are giving two number, away the thumb we are giving three numbers. So if this is finger, because it is nearby the thumb, so I'm giving this is the first number. Okay, I will show you. Okay, so what is the name is given here? The name is given by Dr. Sir is meniscus. Meniscus one and menis meniscus three here and meniscus two. So these are the very important you have to remember. So let's see in the picture. So this is the thumb. Okay, near the thumb, we are giving number one. Okay, so we are dividing the finger into three regions. Okay, so this is where we are starting the nail is starting here. Okay, this is the from here to here, one, here to here, two, sorry, two, here to here, three. Okay, all these three are in see in this picture. Okay, first and near the thumb. This is the near the thumb. So we are giving number one, one, and middle is two, and away is three. So near the thumb, the number one, it is number one. Okay, number one means still here. Okay, from here to here, we have two number. Okay, from here to here to here, we have three number. Okay, so this three means this three, the part of the finger is divided into three meniscus. Okay, here till here complete. You understood or any doubt?
Understood.
Okay, thank you. Next, we have so every finger is divided into same things. Okay, sanguine or lymphatic. Both fingers divided into three areas. So basically in this we have three areas. In this finger we have three areas. Middle index finger and middle finger. Okay. Okay. So what the three things indicates? This is very important. The first thing, the index finger is sanguine. So here blood making organs, the number one, blood utilizing organs, number two, number three, blood purifying organs. Okay, the meniscus number one is blood making organs, number two, blood utilizing organs, number three, blood purifying organs. Same here, middle finger number one meniscus is used for lymphatic making organs, number two, lymphatic utilizing organs, number three, lymphatic purifying organs. So these three meniscus is separated with behind, the reason is this. Okay, so which each meniscus you are able to see those organs. Understood? Okay, so next we have to remember that we have to repeat that in lymph making organs, utilizing organs, and purifying organs. So this steps are important. Okay, these steps are very important. Kindly join. We are continuing the class. Okay.